I'm Josephine Young, a medical director at Premera Blue Cross. And so I'm a pediatrician by training and was in clinical practice for over 20 years, working in a broad variety of settings, all outpatient, and working with kids basically from newborn all the way through to college age. As time has gone on, behavioral health has come to play a greater and greater role in why kids are coming in for care. So even if they're coming in for maybe like a physical complaint, maybe they're tired or they're having stomach aches or they're having headaches, more of that, there's an underlying behavioral health component just because of the stresses that are there. And for a lot of our teenagers, it's playing out in the way of anxiety, depression. And so, it's been a lot of time spent talking with families about how to help their kids, working with parents about how to create those safe spaces for conversations with their kids so that their kids are not hesitant in coming to them with their concerns, so that they're not worried that their parents are going to somehow judge them or that people in their family or people in their neighborhood or community are going to see them as somehow weak, because ultimately it's actually an amazing sign of strength to be able to recognize that these needs are happening and to be able to take those active steps to say, I need help. Because the only way that the care is going to make a difference is if they feel like they are empowered to be a part of the process, and not only feel like it, but that they are. Because therapy and everything is only for a period of time. And over time, they're going to take that and learn those skills and then go on to apply it to other things that'll happen in their life. The reality is that 6 in 10 adults who have a behavioral health concern aren't accessing help. They're not getting the help that they need. But because it's such a secret thing, we don't know. It becomes really important for anybody having conversations to be able to start to create those safe places. And part of that is just opening up conversations about it. At Premera Blue Cross, part of what we've been doing is working with our employer groups and working with our members to create information sources that they can see on our website where there's information about behavioral health, ways to access services, going through the provider directory to find somebody when they're ready to go see somebody, and it will list their specialties and what they focus on. But then it's also helping people set the framework for these conversations. Because I think, especially for teenagers, I think parents really want to be able to talk to their kids and create those safe places to help them. And we want to make it so that any sort of mental health concerns doesn't exist as an elephant in the room. There's an elephant in the room, let's call it, let's introduce it, let's bring it in. Let's talk about how we're gonna live with this. Because this isn't like a cold that's gonna go away in a few days. If there's a behavioral health issue going on, it's gonna take some time to really kind of understand it, to go through that discovery process, and then to talk about how to manage it going forward.